Why did you choose microbiology?
I think there is no point in wasting the years.
Or can a microbiologist simply survive even in the upcoming 10 years?
Definitely can survive.
What are the opportunities of this field in corporate hospitals?
Definitely for the hospital also. It's cost effective for them, reduce their infection rates.
And what about the government sector?
They have multiple roles.
Pros and cons of this field.
You have your work-life balance, very ideal for the females. We are here to be a clinician and what we are doing. So that is one of the cons of it.
AI will have a big hit in this field in next 10 years.
Jobs are not going anywhere, but definitely yes, AI is coming strongly. That will be a problem for some of the branches other than micro also.
Freshly passed microbiology postgrad should open a lab immediately.
You should not be opening up and directly jump into this because
What is the salary of an MD microbiologist? We are building India's largest community of medicos, and thank you for making it a success. Guys, today I have got a person for the most demanded subjects in the comment section. And to be very frank, I hated this subject. I never understood the M of it. And I think you have guessed it right. I'm talking about microbiology. We all love it, we hate it, but somehow we cannot exist without it. Microbes are an intrinsic part of our lives. So, the speaker I have today, the very special guest, he has been a friend of mine for a very long time. He has passed his MBBS from LLR Merit. He has done his MD in microbiology from RGUHS. He's a professor at KM College Mathura, and he has been educator in our own coaching industry for last 15 years. He's loved by thousands of our students, has mentored so many, and he's a brilliant educator. I think you have guessed his name by now. Let's put our hands together and let's give a very special warm welcome to Dr. Sonu Pavar. So welcome Dr. Sonu sir on the Nachiket Bhatia Show.
thank you so much.
Sir, you're a very famous microbiologist, you're an educator, you have donned many hats. You are a professor in a medical college as well. So before we get on to microbiology as a future career, I would like to know everything about Dr. Sonu. How was your initial journey? Why did you choose MBBS as your career option?
So my father is an inspiration for this. He always says you should be your independent one. You should be a doctor because he have worked up as an agriculture scientist. So have a boss pressure and all. So he wants you should be independent in that particular sense, and it's better to go for a doctor one. So that is what is the main inspiration and all. From there itself, I've got this particular one. And after that, I was good in studies. Right from there, I was used to be a topper in my school. So that also makes them that yes, one day he will be there. And then as the journey goes, I was got selected in LLR Medical College, and then the same things MBBS, which goes first year, second year, third year. So it was fun journey actually. A lot of friends and a lot of struggles also, sort. And after that, this particular one, I've gone for this PG stuff. And in that, lot of coachings are also there. We got into. And actually then something happened in the life. So that particular phase was bad. And the meanwhile, some stages of that sort also come, I will do something or not in future. So I think a lot of things are destined in life, and this is what is my destiny, that I got through this. And definitely, if you are positive, then you will be at the top, and that's what I follow. So even after that MD Micro and all, I achieved what I wants to.
So would you like to share what was the bad phase?
Not exactly there was some family problems and all. So because of that, some stress happened and got off track and all that. But later on, everything managed off well, and that's what stay. If you are staying positive, then everything will turn out to be good. I suppose I strongly believe in that. So that's what I have maintained up the calm and all that. But obviously, as a journey and all, after the MBBS, we think that this pre and para ones, slight bit like nobody will take and all that particular one. But if you are into it and if you are getting up positive, so definitely the results are good. So that's what I followed, and the result is in front of you.
So many of our students, I would say audience, actually have, gone through some unfortunate scenarios,
Yeah,
especially during MBBS or immediately after MBBS.
right,
And then they lose their track
right.
on how to carry on their future journey. What would your advice be? If something unfortunate happens, how to get your mind back on track?
Actually, I want to share one incident of an internship in which, like, firstly, I was posted up in a pedia, and my senior was there, like my college senior only, and she have got admitted in MD first year, and I was a good friend. So on the very first day, she told me like, you want to have that practice of injectables and all, you want to put the vaccines. So the first day you are in the internship, and some says that sort, slight bit of fear is also there. Then and from very beginning, whenever you are a doctor, you feel like that these procedures you should know. So in the internship first day itself, I has got that opportunity. So on the very first day, you will not believe, I have done the 50 vaccinations. 50 vaccinations on the same day. So I was like, what is this? This is very easy. What is this? So all that I have done. But suddenly, like after 2-3 days, one child came with some abscess, okay, on the thigh part. So like our SR there, like he started yelling, who have given this and all that over the. So somebody pointed up, sir, this new intern have done, and that have reduced my confidence like anything. Okay, so from that day itself, I got like he have made such a scenario of that ki this would have happened, that would have happened, and actually there was a post injection abscess would have gone itself without any treatment also. But that had an impact on me. Then suddenly I felt like if something bad happened, would have died the child and all, what would have. So that fear crept in. And from there itself, I have gone from the clinical one to something else that that confidence was slight bit shattered. So from there on itself, that something was shifted towards this, that what I am good into it, so that I should pursue and all this. So that was also one of the turning points of mine. And the question of yours, like the same thing. If at all these things happens, the people yell at you and don't take it to heart. Okay, the life is full of these particular ups and downs, and if you have a down, then the real person, real warrior is that who stands up again. Okay, so that is what is I have gone through a lot of ups and downs, but definitely every time I stand up. So that is what is my crux of the things, that let it be. The life is a struggle. That is what is there. Okay, like some says like life, so a lot of struggles are there, hardships are there. Life is that hardships and struggle. It is okay. You have to manage.
So, do you think that the toxicity shown to you by that senior, now that toxicity is now so much prevalent that it shatters the confidence of the juniors? It is, of course, very disrespectful that you are being shouted for unnecessary reasons.
Right.
I mean, if you could say that it was just a post-injection abscess, he could have clearly told you very calmly also that, okay, you could have done this thing wrong
Yes,
and you
exactly.
could have actually improved.
Exactly.
But the toxicity is getting prevalent day by day. It's getting more and more. Why do you think this is so prevalent in the medical industry?
Actually, what's simple it is, like the things which you get from your seniors, you tend to pass on to your seniors, like juniors and all. That's what the real problem is. That I have got a toxicity, so I should do the same thing to my junior. This mentality creeps in. The human mentality it is. But somebody have to break this chain. They have to break this chain. They should not be going into this that if this happened to me, so I should be this with the other my junior also. And this starts with us only. Like I will appeal up to all SRs and all those also faculty members. Like, don't make it so toxic. Already the studies are so hard, everything is so hard, the environment is so poor nowadays, patients are after you. And even if you are after your junior staff and or junior residents and all, where they will go? They will land up in depressions, they will land up in all this, and they will regret their decision to be a doctor. So you should not be going into that particular sort of a journey. And this will start with a one person that who stands up, कि नहीं, if this happened to me, I will not be doing it to another one. Give a space, and at the end of the day, you are answerable to somebody else also, like who is above. So if you have that thing in your mind, then you will not be doing all this. Toxicity is bad, and it affects the mental state of the mind of the doctor for sure. It reduces the yield also, like your proficiency also, it's being reduced. Everything is being reduced. So always, because देखो, like bad people are also there, good people are also very there. Like who promotes you, who motivates you. A lot of students will agree that seniors are there, mentors are there, who mentors them in a wonderful way. So that type of environment should be there. And I think when you have majority of that sort, these particular one or two peoples will be subsiding. But we have to change the culture. That work culture should be changed, that this new first year have come. So they should be like bashed up in every possible way. It should not be that way. So you should take it, that fellow also as a colleague, that he is my junior colleague, but some senior of mine have done bad to me, so I should do the same thing. No, you should not be doing that. So that will break this culture. And in fact, if everybody starts trying up in this particular positive environment and all, so things will go in a better way. Definitely.
So guys, I'm going to take a minute here and appeal to every one of you. Please treat your juniors kindly. All right, motivate them, inspire them, be their ideal rather than somebody who they hate and they pass that hateness to their juniors in the coming years. So if we all come together and we create an atmosphere of kindness, I'm telling you, we are going to see a much better tomorrow, a much kinder tomorrow, and a much happier tomorrow.
And a
Because
good doctors, in fact.
absolutely. I mean, confidence is only generated when you see with some validation, some accreditation, okay, that I am doing well and there is somebody to guide me if I fail. If always there will be a fear and apprehension inside you that okay, if I fail, I mean for even a smaller thing, I will be terribly scolded. Automatically, you tend to run away from responsibilities. So that is not the tomorrow we want. We want again a happier tomorrow. Boss, you chose microbiology as your PG career. Uh, I'm sure it must have been a hard decision. Microbiology is absolutely not the first choice. Why did you choose microbiology?
I think the major factor is destiny, which I've told up. Other is like I have a love for microbes, no doubt in that. Like I'm fascinating about staph, strepto, and all. So that love should be there, obviously. Without that, it's impossible to get into it. And that love develops from some teacher, and mine was good teacher who really have vested up interest in this. So that is one of the point. Other is like there is no point in wasting the years, and I am very pretty sure like it is your first attempt and all, so it's not better to go for these pre-para nowadays. We are telling for this scenario. Otherwise, in our scenarios times, in the PG stuff, like if I say my state PG, UP PG and all, in 500, 600, everything ends up with a general guy. Okay, MD anatomy even. That sort of thing is there. So obviously at that particular phase, taking up these things like was a decision because you tend not to waste your time and all. And it's better that if you don't want to waste up your another year and all, and you just want to start up your journey. And for me, like I told you, that some incident was there, like in that it was so that I was doing something or not after MBBS. So that particular sort came. So I've taken up, because I have a love for microbes and all. That is also one of the points. I was getting diploma ortho also. I was getting like diplomas, but my seniors told like it's good to go for MD. And I think a sort of destiny is there who wants to me here, because I was getting at some university MD path also. I was getting DPM also. But the things have turned out in such a way that I land up here and this particular one. And at that time, I was thinking that why it happened. And now I think this is what the destiny wants for me. Because I mean, like in 25th anniversary was there of my MBBS batch, like in Merit and all. And I felt that, yes, I am some, because if you get a students at airport and they wants to take a selfie with you, so you have achieved, man.
True.
You have achieved. And how many doctors as such have that particular credible potential and all, ki to go to that level, and people want selfie with you, and they shout in the air, like plane on itself, Dr. Sonu, where are you? So that is what is there.
Boss, you have had a long journey as a microbiologist.
Yeah.
So now, if you have to put out the pros and cons of this field, what would they be?
Sir, first of all, if you talk about the pros of it, is it's a cool branch. You have your work-life balance. Okay, very ideal for the females, definitely, if they want to maintain the family with it, because they have their passion also of the pursuing of the things, and they have the time for the family. So this is a very big pros. Other than that, the amount which everybody gets, like after completing MD and all, the same thing is for here also. Like if you are becoming a SR of micro, patho, any other medicine also, you will be starting with the same thing. So that is also somewhat same in the initial phase. Then you mature up, and the different journeys they crept in, like you become AP, you become associate, you become professor. So that is also one of the pros, that in the government scenario and these all, everything starts with the same. Like in a government medical college, you also know, like same scales are there for everybody. So that is also in this. Other than that, obviously, it have a wide spectrum. Wide spectrum of what sort? You can open up lab, okay, and it's a paraclinical stuff. And actually now, if you see the NMC curriculum and all, it have become a clinical microbiology. And clinical microbiology means like it's a clinical microbiologist now, not exactly para also. Like the new ones who are getting into infection control practices and all, they take the ward. And they go to the ward, they take the visits with the clinicians and all. And I know a lot of others, like who are wonderful infection control practice they are doing up. And it is what is the domain which is upcoming in the microbiology. So this is also a pros, that you have number of avenues in which you can go in this particular field. And the cons is obviously this much, like after doing MBBS, a lot of people think that this is a job of doing up, signing the reports in the lab and seeing up the microbes, testing up something, samples and all. But that is in the mindset itself. Okay, the things have changed, and we need to change also. And we are going up with that conviction only, previous one, that this is that sort of a branch. But it is not so. If you talk up to the budding clinicians and these budding clinical microbiology fellows, so they are doing wonderful work. And actually, if you say that in US and UK, microbiology fellows, they are being regarded as radiologists. Okay, without their sign and all, you can't give the prescription, because they have the antibiotic policy in their hands. They say that this is infection protocol, this is the medicine protocol of our hospital, this is first line, this is second line, this is third line. Okay, so they have to follow. In India, this culture is getting in. And when it will get in, no wonders, like in future years, this becomes a branch like radio. Definitely it can be. And we should be positive. That is there.
Was there any cons for this field?
Cons are like, if you say compared to the clinical side, that satisfaction part that everybody has, that we are here to be a clinician and what we are doing. So that is one of the cons of it, definitely. You felt like this. Other than that, obviously, everything have a, like if you have a clinical practice and all, so your salary range is beyond, like you can go anywhere. But in this, yes, a particular bracket is there. Other than this, people tends to firstly confuse only micro with patho and all that. But after the COVID, the things have changed. Now they are knowing that they are the people who done the RT-PCR and all that. So that was also overshadowing, that is there. And some para-allied branches are there, like M.Sc micro and all. People tend to think that MD micro is also same. No, it's not actually. So that is also a stigma, that M.Sc micro fellows, they have saturated the things and the market is saturated. But it is not so actually. So that is the cons which I think they are there in the minds of the people also and the students also.
So do you think MSc Microbiology and MD Microbiology, I know they are not same, but can you tell me the differences and how they basically overlap?
Yeah. Let me tell you the difference. Like MSc Micro is like one is Journal Micro. Okay, Journal Micro means they are doing up the works for the industries and all. These beer factories and all, they all include those MSc fellows for their quality control and all. Okay. Other applications are there. The vaccines are produced with the help of microbiologists and all. Okay. So all these avenues, they have those MSc and PhD fellows in them. So that is a, what do you say, journal one. One is a MSc Medical Microbiology, okay, which they tend to enter into the medical field also. Like in the medical college also, they become a faculty, okay. For that, NMC have done now a good thing actually, that they have stopped up those particular fellows entry into the medical college. And the reason for that is, like, if you see the NMC curriculum now for the microbiology, it is all clinical. Okay. Previously, we used to make students study according to the, like, what do you say, organisms. But now the things are as per the systems, like which infections affect the GI, which infections affect the respiratory system. And these, like those who are MSc medical fellows, so they don't have idea of this all. So what is the relevance of having them into the faculty and all? So this was the main hue and cry. But now, like, as per the new NMC stuff, there is zero requirement of MSc and PhDs into the second year. And those who have done it, for them definitely yes, they are into it. But the new ones, they had a lot of barriers now, like MSc fellows and all. So in that particular regard also, your employment opportunities, they have increased. Because the previously medical college, they tend to have them and they want to reduce up their cost burden and all. But now it have become mandatory for them to include up the MD fellows and all. So that is what is the major difference. Because they don't have that clinical stuff. Now what we have done in medicine and all, they can't correlate on that particular sort. Definitely they also lead anatomy, physiology and all. But one cons of them is what? They do it with, like suppose you're working somewhere in a medical college and as an MSc fellow, they are doing PhD in another medical college while doing that particular one. So that's the sort of a correspondence PhD they are doing. So that quality doesn't come. And obviously the MD fellows is a clinical oriented fellow. He have seen all the labs, everything he's seen. He have a clinical acumen also. And seeing this, the NMC have made them eligible for like clinical courses also. And that I will tell you later. Okay. But that is the major difference between MSc and those MD graduates, like postgraduates.
Most government has introduced super specialty for microbiologists as well.
Yeah.
What are the options here?
In the super specialty, sir, like we have DM virology you can do. After this COVID, it has become boom-like. Other than that, in the AIMS, we are now the MD micro fellows, because it's a clinical now. The tag of paraclinical is gone. Now it's a clinical microbiology. And because of that itself, now they are eligible for DM infectious diseases also in the AIMS. And in the AIMS, Jodhpur and all, there are a seat exclusively for these MD fellows for the DM and all. So DM infectious is a good thing to go, and from this particular shift to that, so means it's not a dead one, that after MD nothing. MD after you can do DM, this particular virology. It is there in several centers like AIMS and some CMC Vellore and all. And these infectious disease is a new one which have come, and it's a good actually for the postgraduates of
Which
MD.
branch of super specialty do you think will be the most,
Ideal one, huh?
ideal one in the next 10 years?
Like overall, you're telling in the medical
not just
one?
for microbiology, just for microbiology.
Super specialty.
Yes.
Sir, no doubt DM infectious disease. If you are able to get into that and able to get into that protocol, best.
But that's too less.
There's too less. Actually, there's too less. But super specialty is less only actually. Super specialty is less only, na? That
Do you
everybody will not able to get
But
into.
do you think that right now, in the current scenario, doing a super specialty in microbiology is a must, or can a microbiologist simply survive
It is
in
not
the
a
upcoming 10 years?
It is not must, sir. It is not must, and definitely can survive. And actually, the scenario which is being created nowadays, like the colleges which the government is opening up day by day, medical colleges, they have a huge crunch of the faculties. Okay, huge crunch of the faculties. The pre and para in the next 10 to 15 years, they are in boom. Let me tell you this. Okay, those who are leaving it for the sake of that wasting year, for them it's a big thing that in the next 10 to 15 years it will be a boom again, because that particular type of a boom came in our time also for the para fellows when the new medical college crept in. And now you can very well imagine of the way the pace the government is opening up. They don't have the required faculties for it. Okay, so they don't have the required faculty, so they are going to pay up anything like to the new budding ones. And that is also one of the reasons like why they have made that cutoff so less, so that people crept in. And that particular these MSc PhDs who have crept in because of the shortage of this, that should be over. But that will take time, 3 to 4 years. And after that, I think sufficient of MD fellows in pre-para will be also there, and with a good handsome package for sure.
So you are saying that there is no job saturation in micro.
Sir, I have not met any MD micro who is sitting at home in the wake of like saturation and all. It's there in mind actually, the saturation and all. Now, I have not met even one. Only thing is that if you think that sitting at home only I will get, and besides my home too I will do, that is one of the cons of it. Like actually you have to move. If you are not getting here, then you are willing to move to several kilometers or like NCR place and all that, if you are here or any place you are in India. So if you are ready to slight bit move, no saturation is there, sir. Not at all. And this particular scenario, not at all. They are asking them to come. Please come and join.
So tier 1 is saturated, but tier 2 and tier 3, there are a lot of opportunities.
Like the way the medical colleges opened, sir, that saturation part is over. It is up to you that which medical college is offering a better package to you, so you can go there. And they are offering to these pre and para more. Why? Because scarcity is there, and the pay packages are good. Because if you tend to go there, they want that. The faculty is needed by them.
What are the opportunities of this field in corporate hospitals?
So, like in the corporate one, sir, for the microbiology, the real role of the microbiology is as a clinical microbiologist, as told up you. And they look out for the hospital infection control practices, and they manage the antibiotic profile of the hospital. That is antibiotic stewardship, we call it. And this is what is the domain which is coming up in the corporate hospitals. And it is rewarding, and definitely for the hospital also, it's cost effective for them, reduce their infection rates and reduce the resistance which is increasing day by day. You must be knowing also that now the patients are dying of the resistance. Okay. And because why? Because the culture is not the culture in India. Okay. So we should develop that culture that if you are giving antibiotic, that should be after doing the culture. So that is what is the problem of India. This happens to be in the corporate hospitals. They tend to go for the cultures also in which antibiotic profiles is there. But now in that particular sort also, we have to be like educate the clinicians that this is the importance of this. Okay. And those who are really understood the effect of this, that resistance is increasing, they are cooperating also. But lot other, the older ones, they don't think it's necessary. But it is necessary because antibiotics, they are not coming up, but resistance is increasing day by day. So this is what is the main role of a clinical microbiologist in a corporate hospital. Other than that, they manage up all the reports every day, that which particular bug is there, and which particular culture report, which antibiotic we should give proper to the particular patient and all. So that's all being decided by the clinical microbiologist. But the main role in the corporate hospital nowadays is regarding the infection control practices. Okay. And that is what is the clinical microbiology will be in the future. In the next 5 to 10 years, if you are not well versed with infection control practices, then this field will be a problem for you. Okay. So for the right, when you are in the MD first year, you should be focusing on this. And if in your hospital it is not so, then you can go for certain programs. They are there. Some institutes they carry on, some private firms they carry on. So you should be well versed with that.
And what about the government sector?
So like a particular microbiologist in a government setup or a private setup, they have multiple roles that they have to teach up also. They have their lectures, and other is like in the labs. they have to report also. That depends on your where you are posted. Okay, so they are linked to both. Means they see the overall day everyday reports also. Along with that, they have a scheduled lectures to give to the MBBS fellows. That is also there, and along with that, they involves in these practices also nowadays. That government one like GB Pant and all, they having this infection control practices in the government sense also. Along with the corporate ones, the real training which the microbiologist is getting up is from these government sectors, because a lot of patient load is there in them and all, and a lot of AI have also come up in the microbiology, and in the government setup also, in the clinical, this corporate setup also, there's new machines which are giving up the results in no time and very accurate. So that is also helping up. So it is there in the government also and in the corporate, both ways.
While we were researching for this podcast, we came upon multiple sources where they were saying that microbiologists have much more opportunities abroad rather than India. Does this statement stand true?
So practical, definitely I don't know because I'm not gone there. But yes, my seniors are there in the Saudi and all, and they are in the hospitals, and they have matlab, the amount which a medicine guy gets after 4 5 years, they are getting up in the first year itself there. So definitely, yes, the prospects are good on that particular sense. That if you go to those, they have their exams that you have to pass. Like in UK, MRCP is there. Like that also you can go for it. And the US, a lot of fellowships are there. Postdoctoral fellowships are there. Australia, New Zealand. So these are the places where the seniors have gone and they are doing well. But that acumen of clinical research should be there in you. Okay, you should be ready to fight up those struggles while going up there. Okay, if you are well versed with all those struggles and all, and if you are ready that I will face upon, then definitely they have a scope, and a good scope actually.
What are the research opportunities in this field?
Like if you say in India also, in the government medical colleges and in the private also nowadays, the ICMR funds lot of projects. Okay, like in AIMS, in PGI, these central institutes or Delhi colleges, or as for this like NIMHANS, everything like who has central institutes and all, they get massive funding from the ICMR and other ones. And that funding is of that level, like in CRs. And the students, they are doing up that project, and a lot of people are employed up in this. So that is a whole new domain only, in which the government is also interested, because they want to have their own indigenous products, and that will come after the research itself. Okay, so government is also very serious for the research and all, and they are funding the things like anything. And the new recruits, they are also who are very interested now. For them, it's a loving journey. They love it, like how to get up new things, how to develop some kits for the TB, how to go for the molecular stuffs. So yeah, molecular stuff is one of the avenues, sir. Like nowadays, after the COVID-19, everybody got to know that microbiologist is also there and all that. Okay, and this RT-PCR comes under our purview as per the NMC also. Okay, and with the yesterday only I was with a private lab, and there's a huge lab in Coimbatore, Microbiology Lab. Names is Microbiology Lab, and they are into this molecular diagnostics. And you will not imagine, like they are having a business of over 100 CRs. So sky is the limit if you are interested up in anything, and if you have that passion, if you have the right guidance. Mentor is very important. Okay, if you come to me, then I will like make you see the pros of it, because everybody, like everything have pros and cons, everything. In fact, medicine also have pros and cons, everything have. But it's you where you focus, that becomes large in your life. So that is what is my statement for it. Like 100 crores business is a big thing, and they are doing up nowadays in what sort. They have panels now. Like suppose somebody is having meningitis. Okay, now the things have changed. Things have changed in what sort. Now your diagnosis is also coming in 2 hours, and you are examining of the things, and culture takes time. That is what is the clinician, they have the problem. Okay, ki culture fellows, they take time, 2 to 3 days. How we'll wait for a meningitis fellow, that we will wait for the culture and we will give antibiotic after that? This is an emergency, we should give before only. Why should we send the culture? But now that particular thing is also solved. Like now we have meningitis panels. 46 organisms are there in that particular one. If any of them is there, then you can tell the clinician in 2 hours that this is the organism. Give the antibiotic according to the profile of the hospital. So this is a major breakthrough. Like if you have these panels like meningitis panels, infectious panels, for pneumonia are different sort of a panel, GI are different organisms that does it. So for that is a panel. Only thing is cost. Cost is slight bit high. So you have to work upon that particular cost. Then it will become journalized thing, and that will revisionize the word. And that comes under the microbiology purview. That within 2 to 3 hours, you're getting the exact organism which have done it. So see the scenario, how it can change. In a corporate hospital also, they're doing PGI is doing all this. Okay, AIMS is doing all this. But the local ones, they are not into it because cost constraint is there, government setup, they are not having it. So if you focus upon these particular ones, government, I am also saying up all this, like if you focus upon this, the patient care will also improve, and lot of things will improve on with this. The prospects also of this branch.
Boss, let's talk about microbiology labs in detail. I believe this is a business opportunity in this field. And normally when a student, the audience actually, tries to think about, okay, if I can actually start a business in microbiology, will that be a futile attempt or can I actually make it successful? So boss, let me ask you a very simple question that if you want to start a microbiology lab, what are generally the tests that you do in a microbiology lab and how does it differentiate itself from a path lab?
This is what is the problem of tier 2, tier 3 cities, sir. Like there you can't differentiate. That is the problem. Okay. There you can't differentiate now also, because if you have not having routine with you, that routine CBC and all that, then exclusive microbiology lab is a problem to run in a tier 2, tier 3 city.
But tier 1, okay.
Tier 1, there are corporate hospitals. So that is also one of the problems. But I know certain fellows who are running up the microbiology exclusive labs, and they are very, very successful. They're very, very successful because they have thought of this thing like everybody is going for a routine lab. In that, they will do cultures also. That is exclusive of ours. This is the difference. The culture, the pathologist doesn't understand anything. They just report up. They just sign. Okay. And but that is a purview of who have done the thing on them for 3 years. That knows not that which culture matters, which is a commensal, we should report it or not, and what is the MIC value, what is the importance of MIC value. So that is a core clinical microbiologist only know that this is a value. Pathologist doesn't know. But in a tier 3 city, pathologist just report it. But that is actually wrong. That is not helping to the patient for sure. And I know in the Merit itself, certain fellows are there who have the microbiology lab. They have Vitech. Now new
So if you have to
things are
just
coming.
list down basically what are the tests that comes in an exclusive microbiology lab?
So the various things are there, like the culture first of all, sir. The culture is exclusive of microbiology. Other than that serology part, the serology like these CRP, ASO, latex card test, all those particular ones, they are the purview of microbiology. Okay. Other than that, sir, these particular ones, normal ones, urine, routine urine and all. Okay. And main the things which distinguish the microbiologist from others is the culture itself and the quality of the culture. And that quality of the culture is being done nowadays better by these automated machines like Vitech 2 and all. Vitech 2 is there, Vidas is there, which is having numerous profiles, and they are telling even you the MIC value proper, which is very good for the orthopedicians to tackle up the chronic cases of osteomyelitis and all that. And my clinician friends, they used to talk with me regarding those particular tests only, that they are which drug we should give and all. So that is also one of the things. Your correct, importance to the community is like which actual antibiotic should be given in a resistant case. Okay. So that is also being told only by the microbiologist. No pathologist can depict upon this particular one. And other than that, sir, a number of routine tests also, the microbiology fellows they does. Exclusive is culture.
So if you have to say for a newly postgrad of microbiology, if he or she wants to start a micro lab, exclusive micro lab, so what would your advice be? What is the normal square feet that is required to start a lab, and what are the minimum tests that the person needs to conduct in their lab to actually to say that it's a working microbiology lab?
So, sir, like after a fresh microbiology graduate, if you want to open a microbiology lab, then a 500 square feet area is more than sufficient. Okay. In that, you can have the routine machines like centrifuge and those high media company are there. Like they provide you the culture material and all. Okay. According to that, you can go for the conventional cultures starting. And when you do conventional cultures also and proper incubators and all these particular ones are there, initial cost is very less. Like in hardly 2 to 3 lakhs also, you can start up with this particular stuff. Okay. But your work should be perfect. Okay. Your culture report should be a culture report. It's not a time pass. So when you have that type of a quality that you are adding value to the clinical ones, then definitely the lab will run. Okay. So this is the initial phase. The important is if you are focusing only on the cultures, like in a day you get around 30 cultures. Okay. You put it for that culture and all. And that is report of yours is very good. Definitely in no time, the person, not everybody is doing this. The quality work, nobody is doing this. So you will be famous in no time. Okay, that this particular lab report is authentic and they are really doing the cultures, they are not time passing. Along with that, you're giving them the antibiotic profile. Like in the UTI stuff and all, a lot of persons they come that this antibiotic taken, this antibiotic taken. So for a new fresh graduates, the most sample they will get is urine, stool and all that. Those who are suffering from it of chronic one. Okay. In their life, you have made a change by giving a perfect antibiotic which have cured them. So this is what you should be focusing up in the initial setup of yours. Later on, when you become famous in and around, then you can go for the automations. In the automations, like nowadays, bioMario company is there. I'm not promoting anybody, but they are the giants in this particular one. Vitec 2, Vidas, number of them are there, their products, and they are good also. And they give you the perfect MIC value and all that particular one that will help you to really build up a corporate type of a setup. Okay. And the most important thing is this NABL accreditation. Okay. If you take this, then all these corporate clients will also join up with you that this is a lab, authentic lab, because NABL is a authenticity. Okay. If you take that in this microbiology, which is slight bit tough, but not impossible, that if you take this particular tag with you, NABL, then a lot of individuals will come to gather with you, to mix up with you, to join up with you that yes, they are doing a quality work. So that particular setup of Vitec 2 and all, if you have initial cost of around 15 lakhs and all, important is what I say, whenever you are doing this type of a lab and all, always try to get into a hospital. And if that is not possible, separate also. Otherwise, this all will be more fruitful if you are having a tie-up with a hospital and all, and they are getting the samples every day. So that will maintain your flow also. And you will be having a real value also to that particular hospital and all. The people, they do the problem in this particular sense that they try to open it separately and then they lack in the samples. Because at the end of the day, this is business. You have to have some marketing fellows. You have to tell the clinician the importance, what you're doing, how you're doing. So that particular thing you need to focus upon. That initial setup, if you are able to get into a hospital and all, in that you can expand. Because I know those particular ones, those who have really got a successful stuff in this, they were in a tie-up with a hospital and all. So when they are in tie-up with a hospital and all, then this culture things becomes automated and good for you. And they give you fruitful things, everything in money perspective also and other perspectives also.
So normally, what is the commission sharing, I would say, between the lab and the hospital?
Sir, we should not be speaking on this as
That is the
such.
reality. Na? If you have to start a microbiology lab, you cannot work. It's a mutually symbiotic relationship between the hospital and the lab. We know that it is the sharing part. Without the sharing, nobody is going to send you samples. So to help our students, please share what is the normal commission part that happens.
So around 50% they take up, sir, for this particular test ordering. And actually that sort is prevalent and more prevalent in our north side as compared to south. Okay. So this is there, and obviously the business is business, and in that particular sort, if you're doing it, then it will be more fruitful and more enduring and more long lasting.
So how can a new person who has just opened up a lab create relationship with the hospital? Because India is such a populated country that wherever you go, there are always two people working there in the same setup with the same conditions already. Now, if a new person wants to start an establishment there, in the starting, nobody's going to have a relationship with him. Now, how can that person, how can that doctor, you know, establish a relationship with the hospitals so that they send the next cultures to him rather than the first person?
So that's what I told now. If you do a quality work, that is prerequisite. You have to be quality conscious. Okay, the people tend to take the culture. Okay, some culture will be equal. I will be
क्वालिटी
coming.
वर्क तो तब आएगा ना जब पहले काम आएगा. काम कहाँ से आएगा?
नहीं, काम तो इनिशियली सर ऐसा नहीं है कि बिल्कुल नहीं आएगा, काम तो आता है. लाइक डेफिनेटली द वर्क कम्स इनिशियली ऑल्सो, बट व्हेन दे थिंक दैट यस दिस इज गिविंग अस दैट पर्टिकुलर व्हाट यू से वैल्यू फॉर मनी, then a lot of clinicians are that sort also, sir. Like they are not after money, like they want cuts and all that. They are very quality conscious, that orthopedicians and all. So if you are providing them the genuine reports and all, that you are adding the value to their patients, that you have said that give this antibiotic, sir, it will help. In the report itself you put a note and all. So and it worked, then definitely they are your permanent customers. So first thing is your quality work, and other is business sense, like in what sort you should manage up with your marketing profile, your PRs, like what they talk about, and it should be a mutual benefit, symbiotic and all. So that sort
So
of thing
do
is there.
pharma companies pressurize these microbiology labs to basically promote their own products?
Not exactly, sir. Like, but definitely that is also one of the avenues which I have just asked up, that the microbiology fellows, even MD microbiology, they can also work up in the pharma industry. So that is also one of the avenues which we have not talked about, in which these microbiologists, they are being employed by the pharma industries also, because they also have the quality control protocols. They also have all these culture things. So they also tend to do the cultures every day. So that quality consciousness there also is there. For that, again, they hire up a microbiologist. So that is also one of the
So
avenues.
do you believe that a freshly passed microbiology postgrad should open a lab immediately, or should he or she wait for some time?
So definitely should wait for some time. You should not be opening up and directly jump into this, because firstly you should observe always, not jump into the ocean. Okay, you observe what is happening up, and then you start accumulating the things for you, that what is needed, funds are needed. This is bare amount which I need, like 4 to 5 lakhs. When you up to that particular amount, the savings of yours, then you start up a small lab, that which I told you, like 2 to 3 lakh rupees and all, you invest up and you start up. Okay, then in this scenario you try to figure out yourself that this is a microbiology lab and we do wonderful cultures. When you do that, then the name will go, and when the name will go, then after some time, like after 2 years, 3 years, when you have seen the flow happen, then you can go for the automation and all. And in the automation now, after the COVID, the things have changed for the microbiology in this sense also, that now you have real-time PCR also with you. Okay, and that is like I had also the same lab. Like I had in the COVID lab, and only thing is, like, it was in the third wave, not in the second wave. Otherwise, I would have gone distant in that particular one. So I had an experience of this COVID lab I had, and you also be agreeing up with the person who had it in first and second COVID wave, what amount of money they have got and what amount of things they have got. So these particular pandemics and all, like COVID-19 and all, they have shown up that there is a real need of a PSM fellow, of a microbiologist fellow in these particular epidemics. And you should be prepared. In another 10 years, something else is coming. Okay, now the things are wide open. China is working day by day for all this. Okay, so that have increased the scope, and definitely now new domain which is being added by the NMC also in the second year itself, that you should have a microbiology molecular lab, and in that you can test upon a lot of things, which I've told you also, like infectious panel, meningitis, GI, pneumonia. So they are revolutionary. They will revolutionize the things for sure, for everybody. Only thing is we have to work on the cost. So this is which they will look out on, because what they have, the conventional cultures and automated cultures. Now this is another domain which we should talking about, like meningitis panel and this and that. So I urge, definitely say to the MD fellows who are fresh ones, who are in the first year, focus upon the molecular biology. You should be very well versed with the PCR. You should know everything in and out of them. And if your college doesn't have those facilities, or no teacher teaches you, then there are some courses, 5 days courses that you should do. Okay, but enhance this particular skill of yours. Which one? This molecular stuff by the PCR and all. This is mandatory now if you want to survive in the future. Another is infection control practices. If there's a very good hospital from which you are doing MD and all, automatically it will be there. In the routine ones, with your seniors, you can just mix up, and in the first year, you can just see what they're doing, observe. In second year, start doing it. Okay. And third year, up till, you should have a sound knowledge that how this infection control practices are being managed. Okay. So this is one second thing which you should be knowing up. And if your hospital is not having this infection control stuff, then you can go up again for 4 to 5 days courses are there. They are being done by the NABH. They are being done by certain other institutes, like CMC Vellore does infection control practices seminar and workshops. You should go for them. That enhance your knowledge. That will make you survive in this corporate world, in the government world also, and your future also. So that will secure your future if you are doing up molecular stuff, because that is what is the next forte of the micro.
Let's talk about students appearing for NEET PG and everything, and focusing on taking microbiology as a career. So boss, if you have to list down the top 5 colleges for MD and DNB microbiology, what would those colleges be?
Sir, directly I should tell
Yeah, please. 1, 2, 3, 4, 5.
No doubt in this, the central institutes, they are the best, like AIMS, PGI Chandigarh, JIPMER, okay. Along with that, BHU, even AMU, and all our Delhi colleges are good, no doubt in that. Okay. Besides this, in fact, I should say, all colleges are good. And in this Pune Medical College is very good. Along with this, those particular ones, they are in the Hyderabad. These particular Gandhi Medical College, Osmania, they are very good for micro. And obviously, for DNB, sir, those corporate hospitals like Apollo, the best, Gangaram, the best. Okay, and they have that quality that will make you a great microbiologist. So I will say these DNBs are more good. So you should approach up for DNB, these particular ones. Other than that, one of my batchmates only is doing up in Tata Cancer and all. So that is another level. So these are the ones from which you can go for all these particular ones, fellowships and DNBs and all.
Sir, what would be your advice to a new JR1 entering the micro department? How they should plan their lives for the next 3 years, and what would be your academic advice?
If anybody entering up in the first year, okay, firstly is like with the micro, that tag is there. So I have to speak up on that particular one, because you have in your mind that I've taken micro, and a lot of fellows in that particular sort, they are slight bit depressed. So first thing is, when you are getting into the JR1, you should not be in that mindset. Okay, be positive. Now you have taken it. Now you're married to it. Be loyal. Okay, so that is the first thing. Second thing is, I've told up just now, that from the first year itself, focus upon the molecular ones, because the previous microbiologists, they tend to avoid this. But now your main domain should be on the molecular, because future is molecular. Okay, so from the if you have the base strong, then only your MD will be having relevance. So base strong is with what? Molecular. Then infection control practices. Okay, so that is what is we are going to do after 10 years. And this is what will be the real domain of microbiology. So infection control practices, molecular one, okay, a sound knowledge of the cultures, and every day you should study well and should not be depressed of any sort. That I have taken this branch.
Perfect, sir. Now, sir, the most sought after question of our podcast: what is the salary of an MD microbiologist immediately after post graduation, 10 years down the line and 20 years down the line?
Sir, immediately when you have done up the MD microbiology, you are at par with all others. Okay, because you will be posted as SR, So that amount starts with 1 lakh, 1 to 1.5 also in Delhi, and depends on particular cities in which you are in. So that particular amount you already touch after coming out. Okay. And after that, nowadays, what I'm seeing up for the MD Micro, like they have a huge demand because faculties are not there. After doing that 1 year of SRship, my advice is that you should join a medical college. Okay. You should join a medical college as a AP, and they are offering very handsome amount like 2 lakhs, 1.5 to 2 lakhs they're offering in most of the medical colleges they're offering up. So that is after 1 year. You go to 2 lakhs. Okay. After that, you promote to associate. And associate is getting up the amount of 2.5, and some they're offering 3 also, 2.5 to 3. And after the associate comes the journey of professor. Okay. That is after 2 years and all, you become a professor. And that particular journey where I am in, like I am getting a handsome offers of 3.5 to 4 lakhs even, okay, per month. So along with the work-life balance. So that's a very decent amount in which that particular thing is there. And along with that, you can earn from the examination ships and all. You can go for the exams conducting. In that you can earn. And besides, like in the private setup, if you are there, like in the private medical college, they allow you for the private practice also beyond the college hours. In that also you can increase your amount and all. So effectively, like in the corporate setup, this particular amount initially, like if you're clinical microbiologist and all, same 1 lakh initial. After the MD, directly you join a hospital, then it is around 1 to 1.5 again. And with the experience and with your domain of infection control and all, you can increase up to 3, 3.5 like that.
So do you think AI will have a big hit in this field in next 10 years?
So AI, I have told you, sir, like already it's there. Already it's there, like these bioMario companies, they have taken up the software, okay, and they have feed in, and that Vitec 2 is doing what? That culture which you are doing conventionally, they are doing it. And more precise, they are doing it. But still, microbiology fellow, they analyze it and they tell that which particular thing to be done. So jobs are not going anywhere. Jobs are not going anywhere. But definitely, yes, AI is coming strongly, and that will be a problem for some of the branches other than micro also. Okay.
So for the last question of the evening, before we move on to the rapid fire questions, so can you share which branches would be the the best branches, top 5 branches that you can recommend, and it can be anything, medicine, surgery, and we have to talk about the super specialty ones here. Any branch, top 5 branches you think will have a blast in the upcoming 10 years,
Blast in what sense?
that they will be the most prevalent one, the best earning ones, and having the best future, the best potential upcoming 10 years.
So as per me, that some branches which are evergreen will remain evergreen because the population is also increasing up, like medicine, surgery, they will be there. Other than that, definitely the way the AI is coming up, radiology might take a hit. Okay. But definitely radiologist, that is on the basis of the ultrasound and all, they will be at a different level for sure. So that will boom in that particular sense. But AI will definitely take a hit on the CT MRI aspect. Okay. But ultrasound, the AI also can't do much. So they have to do, somebody have to do ultrasound, and they somebody have to like report it also. So that is one thing. Skin, so dermat, the way the people are becoming conscious for their wrinkles and all, the Botox treatment, and the hair transplant and all. So that definitely is a boom. And now the government is also serious that nobody else can do other than dermat and MCH fellows for that. So that will be in the boom. And along with that, so these definitely, I am a positive person. So I will say for the micro also. Because radiology is that sort of a branch which previously 20 years back, nobody was taking. And everybody was thinking it's a paraclinical branch and who will know patient interactions and all. And now you think like every topper wants to have a work-life balance. Nobody wants to be having the night shift and all. So the same I wish for the microbiology. That should go in that particular domain. That should boom like anything. Okay.
Great, boss. By God's grace, it definitely will. So let's move on to the rapid fire questions. Boss, very simple. Two statements here. You have to be super spontaneous and super truthful. So, are you ready?
Yeah.
Perfect. If you weren't a doctor, what profession would you choose?
Sports person.
Very nice. Which childhood dream would you still like to fulfill?
Playing guitar.
What's the song you have heard on repeatedly?
पल पल दिल के पास तुम
क्या
रहती हो.
बात है. if you could ask your future self one question, what would that question be?
Am I doing enough? Like, what legacy I will have for my students, for my children? That is what is in my mind.
Favorite quote you live by?
Nothing is permanent.
Nice. What instantly lifts your mood?
Music.
Work-life balance or hustle hard? What have you chosen in life?
Now definitely work-life balance, sir. And before I've really hustled hard, but now work-life balance.
Great, sir. Thank you so much for this insightful discussion. You have really simplified microbiology for all of us. So, on behalf of all the audience, thank you so much, sir, for clearing all our doubts.
Thank you, Dr. Nachiket. It's
And
been honor.
thank you so much for being a part of the Nachiket Bhatia Show. And thank you guys for watching today's podcast. I believe Dr. Sonu has given you everything you need to know about microbiology. So if you are still in that fear, is microbiology a clinical branch? Then please go through this podcast again, share it with your friends who are having a nervous thought about microbiology, and tell them this branch has a very great future. With this, we come to an end. Thank you so much for being a part of the Nachiket Bhatia Show. And before you end, do not forget to like, share, and subscribe. Thank you so much. God bless you and all the best.